What childbirth was actually like 50,000 years ago. You're pregnant. It's 50,000 years ago and you have no doctors, no hospitals, no ultrasounds, no epidural, and no pain medication beyond what your local plants can offer. Over the next 9 months, your body will change in ways that feel both miraculous and terrifying. Your belly expands, your feet swell. Morning sickness comes and goes. And then, one day, the contractions start. This is the reality of childbirth in the Pleistocene, a truth that has shaped human evolution, culture, and survival for hundreds of thousands of years. The obstetric dilemma: why human childbirth is so difficult. Here's the brutal truth. Human childbirth is uniquely hard, and it's all because of your brain. About 2 to 3 million years ago, your ancestors' skulls began expanding. Larger brains meant better tool-making, better problem-solving, better survival. But there was a catch. Your pelvis, the bone structure through which a baby must pass, could only expand so much before it compromised your ability to walk upright and run from predators. You were stuck in an evolutionary bind. Your baby's head needed to be large enough to accommodate a developing brain, but your pelvis needed to stay narrow enough to allow efficient bipedal locomotion. This mismatch is called the obstetric dilemma, and it's the reason human childbirth is so dangerous. Compared to our closest living relatives, chimpanzees, human babies are born remarkably helpless and underdeveloped. A baby chimp can cling to its mother within hours of birth. A human infant? It can barely open its eyes. This immaturity forces human babies to be born earlier in their development, and it means your labor will be longer, harder, and more painful than any other ape on the planet. The social support system, community as medicine. But you're not alone, and that makes all the difference. Archaeological and anthropological evidence suggests that ancient humans, including our Homo sapiens ancestors 50,000 years ago, lived in tight-knit bands of 20 to 50 people. During your labor, you would be surrounded by women. Your mother is there. Your sisters are there. Your aunts and female cousins are there. And critically, so are older women, postmenopausal women who have survived childbirth themselves and know exactly what you're going through. Anthropologist James Sussman, in his research on hunter-gatherer societies like the San people of the Kalahari, documented that childbirth was a communal affair. Women would gather around the laboring mother, offering physical support, emotional comfort, and practical assistance. Some would massage her back. Others would bring her water or chewed medicinal plants. The presence of experienced women, what researchers now call doulas or birth attendants, has been shown in modern medical studies to reduce labor duration and decrease the need for pain relief. In the Pleistocene, these women were your lifeline. Pain management without pharmaceuticals. You're in labor now, and the pain is unlike anything you've experienced. Your contractions come in waves, tightening your uterus, pushing the baby down. Between contractions, there's a moment of relief, but you know they'll come again, stronger, closer together. Your community knows this too, and they have methods to help you cope. Archaeological evidence from plant remains found in Neanderthal sites suggests that early humans understood medicinal plants. A 2012 study from Spain examined dental tartar from Neanderthals and found traces of yarrow and chamomile, plants with analgesic and anti-inflammatory properties. Your group likely knows dozens of plants: willow bark, which contains compounds similar to aspirin; cannabis, used in childbirth in ancient China and India; and possibly ergot fungus, which causes uterine contractions and can help expel the placenta. These aren't painkillers in the modern sense. They won't numb the pain. But they can dull the edge, reduce inflammation, and help your body do what it evolved to do. You're also using other techniques. Movement helps. You walk, you squat, you rock your hips. Gravity is your friend. A vertical or semi-vertical position makes it easier for the baby to descend. Your attendants apply pressure to your lower back and sacrum, a technique called counter-pressure that research shows reduces pain. They encourage you to vocalize, to moan, to cry out. This isn't weakness, it's physiology. Vocalizing during labor helps you relax your pelvic floor and increases oxygen flow to your uterus. The actual birth. a dance of patience and pressure. After 12 to 24 hours, or sometimes much longer, you feel a change. The baby has rotated and descended. Your body begins to push involuntarily. This is the second stage of labor, and it's where things become dangerous. Without modern intervention, complications like shoulder dystocia, when the baby's shoulder gets stuck, cord prolapse, when the umbilical cord precedes the baby, or placental abruption, when the placenta separates too early, can prove fatal to you, to the baby, or to both. Your attendants watch for signs of trouble. They've seen births before. If the baby isn't progressing, they might apply pressure to your abdomen, a technique called fundal pressure that helps push the baby down. Though modern medicine now questions whether this technique causes more harm than good. They might massage your perineum, the tissue between your vagina and anus, trying to reduce the chance of severe tearing. Most likely, you tear anyway. The skin stretches, sometimes to the point of ripping through multiple layers of tissue. And then, suddenly, it's over. The baby emerges. Your attendants wipe away the amniotic fluid and blood. The baby takes its first breath, sometimes on its own, sometimes with a little assistance. The cord still pulses, delivering oxygen and iron-rich blood to your newborn. Someone ties the cord using plant fibers or sinew, and once the pulsing stops, they cut it. The umbilical stump will dry and fall off in a few days. The third stage, the placenta and infection risk. You're not done yet. The baby is in your arms, but the placenta is still inside you. This third stage of labor is critical and dangerous. If the placenta doesn't deliver within 30 minutes, you risk hemorrhage. If it tears and bits are left inside, you risk infection. And infection in the pre-antibiotic world is often fatal. Your attendants help the placenta deliver. They might apply gentle traction to the cord. They might massage your uterus, encouraging it to contract and expel the organ. They might have given you ergot fungus earlier, which causes the uterus to contract and helps with both delivery of the baby and the placenta. Once the placenta is out, they inspect it, making sure it's complete. In modern obstetrics, retained placenta is a medical emergency. In the Pleistocene, it's a death sentence. Slow, painful, and almost inevitable without surgical intervention. The placenta is now treated with respect. It's not discarded. In many ancient cultures, it was buried near the home, a practice called placentophagy in reverse, a ritual honoring the organ that sustained the baby's life. Some groups may have even eaten it, a practice that does provide some nutritional benefit, particularly iron and other micronutrients lost during labor. Recovery, the fourth trimester. Your labor is over, but your ordeal isn't. You're bleeding heavily, sometimes for weeks. Your perineum is torn and swelling. If the tear was severe, it may have extended to your anal sphincter, a complication that would cause you permanent problems with bowel control. You're exhausted, your nipples are raw, and your baby wants to eat constantly, and you're vulnerable to infection. Infection in the postpartum period, what's called puerperal fever or childbed fever in the pre-modern world, has killed more women than almost any other cause. Your vaginal tears, your exposed uterine lining where the placenta was attached, the warm, moist environment of your postpartum body, all of this is a breeding ground for bacteria. Without antibiotics, without sterile conditions, without even a basic understanding of germ theory, infection can set in within days and kill you within a week. Your community does what they can. They keep the birthing area as clean as possible, using water. Perhaps boiled if they've discovered fire-heated water, though this isn't universal. They apply poultices made from plants with antimicrobial properties. Someone stays with you at all times, watching for signs of fever or infection. But ultimately, you're relying on your immune system and luck. Why so many women died? Archaeologists can piece together ancient mortality rates from skeletal remains. Studies of pre-modern human populations, including analysis of skeletons from sites like Sudanese Nubian cemeteries and Paleolithic burial sites, suggest that maternal mortality rates were staggeringly high. Perhaps 1 in 25 to 1 in 50 pregnancies ended in the mother's death. That's roughly 2 to 4% of pregnancies. By comparison, the modern global maternal mortality rate is 0.005%. In rich countries, it's closer to 0.0001%. Women died from hemorrhage. Women died from infection. Women died from eclampsia, a condition where high blood pressure during pregnancy causes seizures. Women died from amniotic fluid embolism, a rare but usually fatal condition where amniotic fluid enters the bloodstream. Women died from obstructed labor, when the baby couldn't fit through the pelvis, and neither the mother nor the child survived. And many women survived the birth itself only to die slowly, painfully, from puerperal fever in the days and weeks that followed. This wasn't a failure of ancient women or ancient communities. This was the brutal reality of human biology. The obstetric dilemma meant that childbirth would always be dangerous. The only things that changed were the tools and knowledge humans accumulated to reduce, but never eliminate, that danger. The aftermath. Life goes on. If you survived, and most women did, you now face the challenge of keeping your baby alive. Your newborn is vulnerable to infection, to malnutrition, to dehydration. You'll breastfeed, and because you're nursing, you'll likely be infertile for 2 to 3 years. This natural spacing of births has been documented in modern hunter-gatherer populations and was probably true for your ancestors as well. It's a built-in protection. Your body won't get pregnant again until your current child is old enough to supplement breastfeeding with solid food. You'll carry this baby, sleep with it, feed it on demand. Your community will help. Older women, your mother, your sisters will all take turns carrying the baby, allowing you to rest, to gather food, to tend to your other children. This is the village that raises the child, and it's based on necessity. Without this support system, human infants would not survive. Conclusion. The cost of consciousness. Childbirth. 50,000 years ago was dangerous, painful, and sometimes fatal. But it was also a profound expression of human resilience, community, and the evolutionary bargain we made when our ancestors developed larger brains. We traded easy childbirth for consciousness, language, culture, and the ability to imagine and create beyond the immediate present. Every woman who has ever given birth has paid a small price for that bargain, a price that has been paid in blood, pain, and sometimes in life itself. Understanding this cost, this sacrifice, gives us a deeper appreciation for the women who survived it, and for the remarkable process by which our species continues.